Hi, this is Gigi. Well, I just had a total knee replacement, and I just kind of wanted to show you because I couldn't find very good videos on how it was, but my knee replacement was 6 days ago. Tomorrow it'll be the week. So I'm going to reverse the camera and I'm going to show you what it looks like now within a week. The left, well, you're right, but my left is the normal knee, or I guess it has osteoarthritis on the knee too, which actually needs a new knee replacement, but the right one was my worst. And that's 7 days tomorrow, post-operatively. Tomorrow, the bandage comes off. So, a lot of bruising, a lot of numbness, swelling, but I have full extension, and I have to get my tie to show you how I can extend it, but you got to keep your legs elevated. So I do have a Tempur-Pedic bed where I'm able to keep my head up and my legs elevated straight. You don't want to put a pillow under your knee and crink your knee. You want your knee to be completely straight. And you want to do your leg pumps so you don't get blood clots in your legs. 10 times of that. Then you got to do gluteal squeezes, which are your butt squeezes. It's kind of weird, but you got to do that because that helps with blood clots from the hip and the buttock to the leg. And then you have to push down on your knee like I'm doing. These are all exercises you'll be taught prior to your surgery, and then you have to do right after your surgery. Of course, it was very painful. I had to be on oxycodone for the first 3 to 4 days. Was hard, but take it and apply the ice. That's my message to you. It's there for that. You have pain, you take it, and you let your leg rest and learn to heal. So I do those. I have to push down on my knee and make my thigh tight. So I had a total knee replacement, and I had I had a spinal done with it with light anesthesia, but I did not have the femoral block in my thigh muscle. The doctor came in and said no, he didn't want that done for me, which I'm kind of glad. The less the better for me. That's the way I like it. And then if I lay my bed down flat, the legs, I'm lucky because we just bought this bed after having a bed for 30 years that we didn't. We just got a new bed. So then the therapist told me to tie 2 ties together. And so I tied 2 ties together, and you put them on your foot. Now I've been using shoes lately because I feel good in shoes. But you bend the left leg up and the right one, and this is to help you with your flexion. So I take a good rope, pull it, and you try to go up. Oh, that hurts. And you do this 10 times. And the reason it's not going so far either is because it's swollen, and the swelling limits your flexion. So I have to do this 10 times, twice a day. Okay, I didn't count them, but I just want to show you a little bit of what I'm doing. Then you take this and you go out 10 times. 1, 2, 3. Okay, you do that 10 times. And then you take your leg and you go up like this. Oh boy, look at it there. And down, and up, and down, and up, and down, and up, and down. And then she has me, when I stand, I have to march in place, and 10 times, which I do 20, so that knee gets marched 10 times. And then I have to stand on my toes, which is good. 10 times. Just stand there and hold onto your walker. And I don't have my walker here. It's down in the living room because I'm moving around now. I'm going down the steps using a cane, between a cane and a walker. And then between a cane and a walker. And so I'm getting better. Oh, I wanted to tell you this too. The other exercises, let me finish the exercises. You sit in a chair. You have to kick your leg out. Kick your leg out 10 times. Now those are all the preliminary exercises. Now I'm going to sit up and show you what pills you got to take, what you got to take. My doctor has me on daily aspirin in the morning and at night, baby aspirin for blood clots for a month. Meloxicam in the morning for muscle relaxer. Colace, stool softener. And then in the evening, I take another the aspirin in the evening. Gabapentin for nerve conduction. Get your nerve sensation back because it's numb at the incision site and around the knee. And then Colace again, a stool softener. You got to take the Colace. And then every other day, I'm to take Miralax. And which I did, which I'm glad I did, because then I had a normal, you know what. And it's also very hard to go, but you have a heightener. Get a toilet heightener. You have to have that. There's no way you have the strength to pull yourself up even with one good leg. So you need a toilet heightener, and when you sit down, you put your right leg out, or your left leg, whichever one was surgery-wise. You put it out, straight out, and then the one that's good, you leave down so that you can bear your weight, you know, and push down as you're kind of bearing to go to the bathroom. Even when you urinate, that's how you have to do it. And then I can take Tylenol Tylenol, 1,000 milligrams 3 times a day only. So I do that faithfully for anti-inflammatory effects and pain control. And then I have OxyContin, what I could take as needed, 1 to 2 tablets every 4 hours, which I took the first couple days regularly and faithfully with ice. Now I stopped the ice on and off now, and I do use heat sometimes on my thigh because it just makes it feel better. It just feels achy. So, but I'll tell you what, I'm getting stir crazy. I hate staying in the house, and I haven't been driving anywhere, so I hate this. But I'll give you an update. I see the therapist again tomorrow. I see her Friday. I see her tomorrow, Tuesday and Friday. Then the following Monday, then I follow with my doctor for a 2-week follow-up. And then I did my plan is outpatient therapy the day after I see the doctor. So every day gets better. Just know that. Even from the first day, it gets better. But they do walk you right after surgery. I mean, the minute that you wake up, they give you food to eat, and they say, okay, you're ready to go. Well, I wasn't ready. They stood me up, and I got lightheaded, and my blood pressure dropped. So they had to give me fluids, wait another hour, but they did walk me in the halls, and they took me to steps. I had to learn how to go up and down steps with my new knee. And you have to realize what they put in there is steel, and they actually glued it in, so it's permanently put in there. It's almost like nail and glue in there, right into your bone. So it's not moving anywhere. And even the button they put behind a patella isn't moving. It's in the patella. And then also the polyurethane ligament filled between the two joints. The thing that hurts a lot is the incision, the swelling, and all that. So I'll show you my knee one more time, and I'm going to sign off, and I'll tell you in a week how I am. There it is. A lot of bruising, but it's expected. You have pre-made meals for yourself too. Or I had a neighbor, thank goodness, brought me over some pasta. She made some stuff, and another friend some lasagna, and I made some spaghetti sauce and soup. Make sure you have soups so you can eat that. Try to do a lot of fluids. And I hope you find the right surgeon. Try to get the top in the city. I had the Mako robotic arm with my surgery. It was 45 minutes. I was in there in an hour, 45 to an hour. They said I did really well. So, and my surgeon's top in the city of Pittsburgh. All right. Thank you. Bye.